everyone, welcome to week 2. This week what we are focusing on is the urinalysis and blood collection, but blood collection is really going to just focus on the capillary puncture itself. So that's going to deal with chapters 3 and chapter 4. Let's start with chapter 3, that's going to deal with your urinalysis. And the first thing that I really want to talk about is how your urinary system works. And the parts of your urinary system and how the flow of urine actually works. So urine actually starts by forming in your kidneys. And those are the areas, you have 2 of them. They're located more towards the back of your body, and they're actually shaped more like beans. And kidneys are about 4 to 5 inches in length and diameter. Then from your kidneys come your ureters. And the ureter's job is really to carry the urine from the kidney to the bladder. Okay, these are generally muscular tubes that are about 10 to 15 inches in length. From your ureter, it filters into your bladder, which is really a hollow organ used for holding urine until it's ready to be expelled. From your bladder, it comes out of the urethra. And for men and women, it's different sizes. So, women's, yours are shorter. They're about 1.5 inches, where men's urethras are about 8 inches. So kind of an important tip there to know what the difference is. And the urethra's job is really to carry the urine out of the body. Where it actually gets expelled out of the body is called the urinary meatus. So that's that final piece right before your urine gets expelled from your body. Second thing that you'll need to know with the urinalysis is how to tell a patient the different ways to collect a sample. There are 4 ways that we collect samples for urine. First way is called a random specimen. This is the most common specimen that you will come into contact with, and the reason being is that we don't need the area to be cleaned. So we generally ask for patients to collect the midstream part. So what that means is the patient will start voiding into the toilet, catch the middle of the urine, and finish voiding into the toilet. Okay? You really want to have about 25 milliliters in order to run any sample on it. That's about the least that we can take. Second type of testing or collection type is called a first morning specimen. And that's what we really like to use for pregnancy testing, because it's the most concentrated with all the dissolved substances that we're looking for. So urine should be held in a bladder for about 8 hours to give us a correct sample. That's why we generally like to collect it first thing in the morning. And third, we have our clean catch specimen. So it's going to be very similar to the routine testing, but what's different is we're going to give patients 3 antiseptic wipes and ask them to cleanse the area that we'll be collecting the specimen from. Lastly is the timed specimen. And this is where we'll generally collect a specimen for a certain allotted time. Generally, it's 24 hours. They'll start the collection after their first morning sample. Every sample after that they will actually collect and keep, okay? Then they'll bring it back in for us to run tests on. It is pretty important that you guys look over the procedures for those within your book, because we will be having a procedure this week, and you're going to tell me how to collect a sample. I'm going to throw different samples at you, so please make sure that you look over all of those, okay? So now that we know, how urine is formed and how we're going to tell people to collect it, let's talk about the actual urinalysis itself. So a urinalysis can be chemical or physical. The chemical piece we're going to talk about in just a second. Physical is going to be made up of actually physically looking at the urine, smelling the urine, being able to test its color, its odor, and if it's transparent or not. Chemical, on the other hand, is when we're going to use those test reagent strips and the machine. And the test reagent strip is going to have little pads on it, and those pads are going to have a chemical that if it is found in the urine, it will react to it. Okay? What we'll look for in those test strips are going to be things like specific gravity. We're going to look for pH, glucose, ketones, bilirubin, urobilirubin, blood, protein, and nitrates. You can look in your book and find out which each of those means. I'm not going to go through each one with you. Okay? Next piece that I want to talk to you guys about is how to perform a capillary puncture, and really what that means. So a capillary puncture is simply called a skin puncture. We generally do it on fingers, fingertips, and heels, but you can do them from other places. We would do a capillary puncture when we don't need a whole lot of blood, or maybe we have a patient who is a cancer patient and they have very frail veins, and we don't want to try to cause more damage than we need to. So we'll generally try to do a finger stick instead of actually poking that patient. Another reason would be if you've got a patient who's got a lot of scarring, sometimes doing a finger stick is easier than trying to go through scar tissue to collect a sample. Capillary punctures are fairly simple. They don't take a lot of time or a lot of manpower, but what we use when we're doing this is called a retractable lancet. And that lancet, once you use it, is going to be a one-time use only. That needle will not come back out to be able to be used again. So it's very important to know that. We generally will use these when we're doing glucometer tests, but we can also do it when we collect specimens for point-of-care testing, or POCTs. What you'll want to do is, first of all, you'll wipe the finger clean, or whatever area that you are using. It's important to know that the only fingers that we use for capillary punctures are your middle and ring fingers, so only these two. A nice little way I like to tell students to remember is if you did the I love you hand, or rock on, or whatever, however you want to look at it, the only two fingers that really don't get any love are these guys because they're facing downward. So those are the two that we're going to use to do our capillary punctures. So you'll wipe the area clean with an alcohol pad and allow it to dry on its own. Do not try to blow on it or air dry it with your hand. Once it's dry, you'll want to puncture the skin perpendicular to the whorls of the finger. Reason being is that if you go parallel, what happens is the blood will drip down the finger as opposed to forming the blood droplet that we want it to. Okay, so always remember perpendicular to the whorls of the finger. You'll always want to wipe the first drop of blood away because that drop of blood will contain tissue fluid, and that tissue fluid actually will dilute your sample. So you always want to wipe that first drop of blood away, collect the second, and thereafter. Alright guys, another important piece to remember with capillary punctures is that you only want to go 2 to 3 millimeters in depth for adults, and no more than 2 millimeters for children. The reason being, if you go any deeper than that, you'll end up hitting a bone and causing osteomyelitis, and what happens then is that they get an infection and an inflammation of the actual bone itself, which then can cause them to lose feeling in their fingertips and potentially having to have those parts removed. So you don't want to do that to a patient. Alright, so that's kind of the big things that I want to talk about with you guys this week. Please remember that your diversity project scenario is due on Sunday. Remember, that's a 1 to 2 paragraph scenario about what your topic's going to be. Nothing really serious. You don't have to go too in depth. Just give me a rough idea of what you're looking for your scenario to be. Remember, I asked you to give your patient a name that makes them real and that makes the scenario real. Also, this week you cannot do your discussion post until after you've come to class and done the lab. So with that being said, your discussion post this week will be due Friday by 5 p.m. Your responses are still going to be due on Saturday, but your initial post is not due until Friday. Again, that's because in order to actually do the work in the discussion post, you have to be able to do the lab for this week and use those results. Alright, ladies, I look forward to seeing you all on Thursday. Have a wonderful week. Bye-bye.